In this video, we will explore viewing history, adding treatment and adding clinical notes. Here we will continue the customer journey as the treating vet, picking the patient up from the reception team's initial part of the workflow. To begin the consultation, navigate to the waiting list via the day list icon on the left-hand side. Please note, if your surgeons are listed as room names, i.e. consult room 1, consult room 2, etc., it is possible for the treating vet, when taking a patient into consult, to click on the appointment and select the surgeon button and select their name from the list. This ensures the other vets are aware who is treating each patient as they arrive. Now double-click the appointment. This will open the patient's record in the History tab. This action will trigger the patient's status to show as in treatment and will be listed in purple within the waiting list, as you can see here on the duplicate screen. This allows the whole team to check where each patient is at a glance. Within the patient's record, note the patient summary panel which appears on the left-hand side. This provides a quick overview of key patient health information, such as any ongoing conditions, notes, patient and compliance reminder information, and this can be minimised by clicking on the double arrows. Along the bottom of the screen, Merlin also provides a quick summary of other patient and client information. Any saved history from a previous PMS will appear here under the Archive tab. Within the History tab, information is paged to assist performance of Merlin, so in the bottom left-hand corner, if necessary, you may navigate through the history page by page. To search by a keyword, type into the description box, press enter, and Merlin will show all entries where the word or product has been included. It is also possible to right-click an entry and select Repeat for today. This allows the vet to quickly duplicate an entry for that day, redispensing or charging for a previously prescribed or sold item. This item will then appear in the Add Treatment tab for the vet to commit to the patient history by clicking Save. Once we're ready to add today's fees for the patient, click on the Add Treatment button, and we can now type the treatment or professional fee in the description box and select from the options which will be prompted. Alternatively, we may search within the left-hand panel, select a treatment type, and now view the fees within this area and select the relevant entry from this list that appears below. When adding fees via either method, it is possible to use the wildcard search by placing a percentage sign before a word, and we can find all fees which contain these characters. For example, if we type the percentage sign and the word adult, we can see a selection of entries containing this information. This can be useful when we are unsure of the exact wording for newly added fees. Please note that as treatments are added to the patient record, the draft balance begins to accrue in the bottom right-hand corner and will be displayed in red. Now, once all treatments have been added, click the Save button, and this action will then commit the fees to the patient record and transfers the draft balance into the final confirmed balance. Once clicked, we have the option of marking the consult as treated and completing the follow-up appointment instructions, or we could select No to allow us to add the clinical notes prior to sending the client to reception. Now click on the clinical icon to add the notes. If we have a microphone attached to our PC, we can click here and speak the notes, utilising Merlin's speech-to-text functionality, which appears in various areas throughout Merlin. Alternatively, simply type the notes in the History, Examination, Diagnosis and Plan fields as required, and then press Save and Exit. If we type an asterisk before the notes, they will appear as red in the History screen. We also have the option to add short text in here for regularly used terms or phrases. Once this is enabled, we can type the short text and the full word or phrase will appear. For example, typing in the word BAR and then space turns into Bright Alert Responsive. If I now look at the short text library area, there is a 4-character limit in the name field. The practice has the option to enable or disable the Enable Individual Short Text Codes setting. This is found under Administration, Settings and Treatment. If this setting has been enabled, then each individual user will be able to see the short text codes they have saved previously. If this setting is not ticked, the user will be able to see all short text codes added by other users. The Clinical Notes area has a feature whereby the clinical notes save after 5 minutes of the user leaving their workstation without saving, and this will be shown with an autosave note at the bottom of the window. If the Clinical Notes window remains open with no action, the default auto logout will get an extra 4 hours added to it. Once this time has been reached with no further activity, the user will be logged out, but the clinical notes will be automatically saved as a draft and show in the treatment draft screen and will not be lost. The user can then view the auto-saved clinical notes, review, and save them. Now the consultation is complete, press Save, and we will receive a prompt to ask whether we want to set the appointment as treated, which triggers the follow-up appointment feature, and this will be covered in the next video of the customer journey.